Have you ever felt just a little off? Like your balance is a bit shaky, your words don't come out right, or your energy suddenly drops for no reason? Many people over 65 think it's just a part of getting older. But what if I told you these subtle changes could be early warnings of something far more serious? I'm Dr. Ariana. For the past 15 years, I've worked closely with seniors, helping them understand their health, not with fear, but with clarity and care. And today, I want to talk to you about silent signs of stroke. You see, strokes don't always come with a dramatic collapse or slurred speech on the floor. In many cases, they whisper before they shout. A slight stumble in your walk, a strange moment of confusion, or even a headache that feels different than usual. These aren't just random moments. They can be your brain's quiet cry for help before a major stroke happens. So if you're over 65 or love someone who is, please stay with me. In the next few minutes, we'll uncover 7 early stroke warnings that are often missed, but could save your life. Let's begin with the very first one. 1. A sudden change in the way you walk. Have you noticed your walk isn't quite the same lately? Maybe one foot feels a little heavier, or perhaps you're shuffling more than stepping. Some people say, I just feel off balance, or my legs aren't working like they used to. Now, it's easy to blame this on age, arthritis, or even old shoes. But as a doctor, I've seen how this small change can be the first quiet warning of a mini stroke, what we call a TIA, or transient ischemic attack. When a mini stroke happens, blood flow to a small part of your brain is blocked for a short time. And if that part of the brain controls movement or coordination, your walking pattern is one of the first things to change. One of my patients, Mr. Harold, 72 years old, came in because his wife noticed something strange. She said he's dragging his left foot when he walks. He never did that before. He hadn't fallen. He felt fine otherwise. But within 48 hours of that change, he had a full stroke. Thankfully, because they caught it early, we were able to treat him before it caused permanent damage. So please, if you or someone you love starts walking differently, maybe leaning to one side, dragging a foot, or moving slower without explanation, don't brush it off. This isn't just about balance or tired legs. It could be your brain asking for help. And here's something even more important. These gait changes may come and go. You might feel better by the next day. But that doesn't mean the risk is gone. In fact, temporary improvement is common in mini strokes, and it's one reason they get ignored. If your walk changes without reason, even just once, talk to your doctor right away. Your next step could be the most important one. Now, let's move on to another early sign, one that hides behind everyday tiredness. 2. Sudden, deep fatigue with no clear reason. Have you ever woken up in the morning after a full night's sleep and still felt completely drained? Not just tired, but a heavy kind of exhaustion, like your body just doesn't want to move. This isn't the usual "I didn't sleep well" feeling. This is something deeper, something that doesn't go away with rest. Many of my older patients describe it like this. It feels like I'm walking through wet sand. Or, my whole body just feels weighed down. Even brushing my teeth takes effort. Now here's what's important. This kind of unexplained fatigue, especially when it comes on suddenly, can be an early sign of a mini stroke. You see, when a small part of your brain isn't getting enough blood flow, even for just a few minutes, it can disrupt the systems that control energy, balance, and coordination. Your brain is working harder behind the scenes, and your body responds by slowing down, even if nothing looks obviously wrong. One woman I saw, Mrs. Elaine, 68 years old, said something that still sticks with me. I just didn't feel like myself. I thought maybe I was coming down with something, but it never passed. It turns out she'd experienced a small stroke during her sleep, and the only symptom was this overwhelming, unexplained fatigue. So here's my gentle warning to you. If you suddenly feel too exhausted to do your normal routine, and there's no clear reason, don't ignore it. especially if you also feel weak, foggy, or off balance. And if this kind of fatigue lasts more than an hour or comes back in waves, it's time to call your doctor. Even if it goes away, your brain could still be at risk. Fatigue is your body's cry for help, quiet but powerful. Let's keep listening. Up next, we'll talk about a sign that often shows up, not in your body, but in your speech. 3. Slurred or jumbled speech that comes out of nowhere. Have you ever opened your mouth to speak, but the words just didn't come out right? Maybe you meant to say, "I'm going to the kitchen," but instead it came out as a mumble. Or your tongue felt heavy, like it wasn't keeping up with your thoughts. Some seniors describe it as sounding drunk, even though they haven't had a sip. Now, here's the truth many people miss. Sudden speech problems, even if they last just a few minutes, can be one of the strongest early signs of a mini stroke. And the scariest part? You might not even realize it's happening. I once had a patient, Mr. Carl, age 74. His daughter called me in a panic saying, "Dad was fine," and then suddenly he was saying words that didn't make any sense. He didn't even notice. That episode lasted less than 10 minutes. By the time they got to the clinic, he seemed perfectly normal again. But a brain scan showed he had experienced a transient ischemic attack, TIA, a temporary blockage of blood flow to the area of the brain that controls language. Here's how you can tell the difference. If someone suddenly starts slurring their words, using the wrong words, coffee instead of couch, having trouble forming a sentence, repeating a phrase over and over, take it seriously even if it passes quickly. Try this simple test. Ask the person to repeat a sentence like, "The sun is shining bright today." If they struggle to say it clearly or their words sound off, don't wait. Call for help. Speech changes, no matter how brief, mean your brain is not getting what it needs, and your next chance might not come with a warning. Let's keep going. The next sign is easy to blame on memory, but it's much more urgent than that. 4. Sudden confusion or forgetting where you are. Have you ever found yourself in a room and suddenly thought, "Wait, why am I here?" Or forgotten the date, the season, or even felt unsure what time of day it is? It happens to all of us once in a while, especially as we get older. But when confusion comes on suddenly or feels stronger than usual, it may be more than just a senior moment. It could be your brain's quiet way of saying, "Something isn't right." One of the most overlooked signs of a mini stroke is disorientation, feeling confused about where you are, what you're doing, or even who someone is just for a short time. Let me tell you about Miss Lillian, 79 years old. Her daughter told me, "Mom looked at me and asked, 'Are we going to church now?' But it was a Tuesday morning and we were in the grocery store. That moment passed in about 15 minutes. She was embarrassed, but insisted she was just tired. But later that week, Lillian had a full stroke. Her brain had given a warning, but no one recognized it in time. Here's what to watch for. Forgetting where you are, even in familiar places. Asking the same question repeatedly, not remembering the answer. Staring off, appearing out of it. Trouble recognizing a familiar face, even for a moment. If these symptoms appear out of the blue, even if they go away in an hour or two, please don't ignore them. Unlike dementia, which comes on slowly over months or years, stroke-related confusion is sudden. It may last just a few minutes, but the damage can still be real. And sadly, many people don't even remember it happened. That's why it's so important for family members and caregivers to speak up when something seems off. Let's keep going, because the next sign is one that's easy to feel, but even easier to misjudge. 5. Numbness or weakness on one side of the body. Have you ever woken up and noticed your arm or leg feels numb, like it's asleep? Or maybe you tried to pick up your coffee cup, and your hand didn't feel as strong as usual? It's easy to explain it away. "I must have slept on it wrong," or "maybe I overdid it yesterday." But here's what I want you to remember. When numbness or weakness shows up suddenly and affects just one side of your body, it could be a mini stroke. Your brain is divided into two halves, and each side controls the opposite half of your body. So when a small blood clot blocks blood flow to one area, you might feel numbness in the face, arm, or leg, a heavy sensation in one limb, trouble lifting your arm or keeping your balance, facial drooping, especially around the mouth or one eye. I once had a patient, Mr. James, age 70, who said, "My wife noticed I was holding the fork funny, like my grip wasn't right. I didn't feel much in my fingers." It lasted less than an hour, but it was a mini stroke. Here's a simple test you can do at home. Smile. Does one side of your mouth droop? Raise both arms. Can you hold them up evenly, or does one drift down? If you notice any of these signs, especially if they come on suddenly, don't wait to see if they go away. Yes, it could be something simple, but it could also be your brain giving you a second chance before something worse happens. And don't be fooled if the feeling comes and goes. Mini strokes often clear up within minutes, but they're often the first warning before a full stroke hits. Let's keep listening to your body. The next sign often starts in the eyes, and too often gets blamed on glasses or age. 6. Sudden vision. Changes in one or both eyes. Have you ever noticed your vision suddenly blur, or felt like a curtain dropped over one eye for just a few minutes? And you might think, "Oh, I need a new glasses prescription," or "Maybe I was just tired." But vision changes that appear suddenly, especially in one eye, are never something to ignore. They can be a quiet warning sign of a mini stroke. When blood flow to the part of the brain responsible for sight is interrupted, even briefly, it can cause blurry or double vision. Loss of vision on one side, temporary blindness in one eye, like someone pulled a shade down, difficulty focusing or recognizing shapes. I remember Mrs. Nora, age 76, who told me, "I was watching TV and everything on the right side of the screen just disappeared. It came back a few minutes later, so I didn't think much of it." Sadly, 2 weeks later, she had a major stroke that affected her entire right side. The hardest part is, many people don't connect vision problems with the brain. They assume it's just their eyes or age catching up with them. But here's the truth. If your vision changes suddenly, especially without any injury, fatigue, or clear reason, you need to treat it as a medical emergency. Another key difference: eye conditions like cataracts or glaucoma get worse gradually. Stroke-related vision problems happen fast and often disappear just as quickly. That quick recovery is why so many people ignore it. But just because it goes away doesn't mean the danger has passed. If your eyes give you a sudden scare, blurriness, flashes, or blindness that wasn't there before, listen carefully. Your vision might come back, but a second chance doesn't always come twice. Now let's talk about one more warning sign, a symptom that often gets pushed aside as just a bad headache, but could be something far more dangerous. 7. A sudden, severe headache with no clear cause. We all get headaches from time to time, maybe from stress, a long day, or not drinking enough water. But there's one kind of headache that should never be ignored, the kind that comes suddenly, feels intense, and seems to appear out of nowhere. Many stroke survivors describe it like this: "It was the worst headache of my life," or "It hit me like a bolt of lightning." This isn't your average tension headache. It may feel like a sharp, throbbing pain, often on one side of the head, sometimes spreading behind the eyes or down into the neck. And it can be a warning sign of a hemorrhagic stroke, where a blood vessel in the brain leaks or bursts. What makes this symptom dangerous is that it's easy to brush off, especially if you've had headaches before. I remember Mr. Dennis, 69, who told his wife, "I just need to lie down. It's a bad headache." But within an hour, he couldn't speak clearly. By the time help arrived, he had already suffered significant brain damage. Here's the key. If you have a headache that comes on suddenly and feels unlike anything before, is paired with nausea, blurred vision, or confusion, doesn't go away with rest or medication, don't wait. Call for medical help immediately. Sometimes your brain only gives one signal, a single painful shout before the real damage begins. Listen to it, because when it comes to stroke, time saves brain. Next, let's bring everything together with a gentle reminder. Because now that you know these signs, you're one step closer to protecting yourself or someone you love. You've just learned about 7 silent signs of stroke that most people over 65 miss. They don't always scream. Sometimes they whisper. Through a weak hand, a strange word, a heavy step, or a sharp pain behind the eye. And I know. It's easy to dismiss these little things. We tell ourselves, it's just age, or I'll feel better tomorrow. But what if listening to that quiet signal today could prevent something life-changing tomorrow? You don't have to be afraid. You just have to be aware. Because when you recognize these early signs, you give yourself the best gift of all: time to act. Talk to your doctor if something doesn't feel right. Don't wait for symptoms to get worse. And if you notice these signs in someone else, don't hesitate. Your attention could save a life. At Elderly Whisper, we believe your body always speaks to you, softly at first, and our job is to help you hear it. So if you found this helpful, please share it with someone you care about, because knowledge, when shared, becomes protection. Take care, stay aware, and never ignore the quiet voice inside that says, something's not right.